Let's shine by seeing the best in all of us and by looking out for each other. Let's stay healthy. Let's shine together.
Hi, and welcome to Let's Talk Together. My name is Sherry Harlan, program host for Let's Talk Together. And today we are joined with Nathan Hogg with Reed Community Engagement, as well as a committee member for the American Foundation for Suicide Prevention. And welcome, Nathan.
Thanks for having me, Sherry.
And I wanted to ask you first, we always like our audience to learn about the person we're interviewing. So tell us a little bit what you're doing in the community.
Yeah, so as you stated, I work at community engagement at Reed Health, and I'm a student here at IU East, where this is being recorded. I'm a junior studying communications with a minor in political science. Very active in the community, work on several nonprofit boards, and AFSP just happens to be one of the boards and committees that I serve on in the community.
Okay. And tell us, what is AFSP?
So during the show, I'll refer to American Foundation of Suicide Prevention as AFSP. So that's an acronym. And it's a leading nonprofit organization dedicated to suicide prevention. And it's fast growing. We have chapters all over the country. We do advocacy work, as well as we engage those personally affected with other community leaders, mental health professionals, and so much more. We do yearly events, which we'll talk about later on in the show.
And how did you get involved with AFSP?
Yeah, so actually when I started working with community engagement at the hospital, our director was working with AFSP and asked me, did I want to volunteer at one of the events? And so I did, and just so happened to like it. And me being one of the younger people, I just brought a fresh perspective to the committee.
Now you've been working with them about 3 years?
Yeah, 3 or 4 years.
Okay, and so makes you keep going back to volunteer?
So just kind of the energy that AFSP brings. I think that they bring something that maybe the community is missing out on through our events, through the conversations that we have in the community that we build with those that have been affected by suicide, as well as those who want to learn more about suicide, or people that don't maybe know how to join in on the conversation. AFSP brings a welcoming environment to those who are curious or to those who have been impacted. So just a community building that AFSP brings, I really enjoy.
And I would be remiss if I didn't ask you, because suicide is such a heavy subject, how does that affect? That work can be emotionally draining.
Yes, absolutely it can. And so one of the things that I really like to do is reflect with those. I always enjoy hearing people's stories. That's one thing. I have a huge heart, if you know me, and that is one thing that I really love is hearing people's stories, and it is emotionally draining. So one thing that I always like to do is connect with those that have been impacted, as well as in order for me to, and then I always look at affirming messages, and then I like to also just be there for people. It brings me joy.
Often I'm sure that people just want someone to talk to you.
Yes.
So being a listening ear.
Yes, is always great.
And allowing them to share their stories, because often people might run the other way.
Yes, you're absolutely right.
So you being a listening ear, I'm sure that's very impactful to some of the families.
Yeah, and especially for those who have been impacted. I've actually lost a couple friends to suicide, and we don't think, I'm only 21, those who are in high school, teenagers, there's a great suffering. And so sometimes, it could be a life-altering decision, if that person felt like they didn't have anybody to talk to. So I always tell all my friends, my phone is always on and give me a call at any time.
And how do you collaborate with like other board members and staff and other volunteers?
Yeah, so AFSP is a chapter nationwide, but we have regional chapters, and so and statewide chapters. So we're under the Indiana umbrella, but East Central Indiana is its own region, and we work with several different counties in the East Central part of the state. And so I get to work with those people in those counties, as well as, different people from across sectors that I may not get to see with every day. So just getting to hear their perspective, talk to them, work with them is always great.
Can you share with us? I know you did a speech through Zoom that was shared in various states. Can you tell me a little bit about that experience?
Yeah, so within AFSP, we try to make sure that we remain culturally competent. And so what that means is we have specific groups that we do programming with. And so I was asked, as a younger person and somebody African American, was asked to do Let's Save Lives. And it specifically talks about mental health in the African American community. And so Indiana may be one of the states that, could, maybe lack, and I'm not 100% sure. But I was asked by the state chapter and I agreed to do it. We have different states that were able to listen in. I think there was maybe about 60 people that joined. And it was just a way for us to talk about mental health affecting those in the Black community. So it was all around a good experience. And so we got to talk about how to stay with them, help them secure or remove lethal means, and just we talked about intergenerational things. And so, for example, in my family, my community, suicide and mental health isn't talked about. And so because of that, my generation suffers from that. And so because we feel like there's a disconnect right there. And so we really just want to open up that conversation for all generations to get serious and to start talking about suicide prevention, because it is absolutely important and it matters.
And culturally, traditionally, that was never talked about, especially in African American homes.
Yes.
And now it's becoming more prevalent because it's happening more often.
Yes.
We just had with the news of the professional football player that what people thought he was at the height of his career, his first professional touchdown, and he took his life. So
yeah, and then sometimes, when you're suffering, you can, feel isolated, feel alone. I always share that I have had my own struggles, and so and it wasn't easy to talk about it, because they're like, oh, well, you're doing great, you're doing this, but you still, can battle with your own thoughts. And so I had to work really hard to get out of my thoughts. And I think serving through AFSP really has helped me in my own personal struggles and journey.
So what changes have you seen with community awareness?
Yeah, so
and openness about talking about suicide since joining in the last 3 years?
Yeah, so to your point about what I have personally seen is people starting to get more serious about the topic of suicide prevention. I'm starting to see a lot of our health centers start to collab with each other. Through our coalition of AFSP, we have almost all health centers represented, and we all work together. We'll share tabling, we share swag and different stuff, and just opening up about the conversation of suicide. AFSP sends a swag, and they have some of the best messaging. We even share it at the read table. It's so great, and just to see and to feel the warmth that AFSP provides and allows us to provide to community members is great.
And when you were saying that, I know within the hospital system, when you have an appointment now with your primary care, they will ask about your mental health, and there's a survey you take. Yeah. So it's that word is spreading. I've participated in the event, but I've also seen just a big change in the numbers.
Oh, yeah. So AFSP and our Out of the Darkness walk continues to grow at a rapid rate, and it's a great time to community build. It's a great time to reflect. and just get together and talk about real issues. One thing that I've did since being on the committee is I have, worked with IUEs to provide mental health cookies. The Den does great, and we have little messaging that we put on the cookies, and they're almost too pretty not to eat. And so, but it's just great the amount, eating those messages, telling yourself that, because once you start telling yourself something, you'll believe it. And, that messaging is just great for people who are suffering.
And it just such a wide variety of attendees. Then we have sometimes you see different corporations will have teams walking. Then there are a lot of people in memory of a loved one. But I can honestly, it feels to me like it's almost doubled in size in the last few years that I've been involved.
Yeah. So, to your point about it doubling, we have been really intentional about working with people who we usually don't work with, and that might be like getting the local bank to be involved. You would think that as a bank, you have nothing to do with mental health, but you absolutely do. And so just working with those different sectors and saying, hey, mental health is part of somebody's well-being. And so we all want to be here for somebody's well-being. And so just looking for ways and being intentional about how to get people involved and personally inviting people to the table, and not just, we want your money, but actually being very intentional. That's all important to gain volunteers, service members, attendees, and on and on.
Speaking of volunteers, what would you say to someone who wants to volunteer but doesn't know how?
Yeah, so I would say first, understand what AFSP does. We do very serious things. We talk about very serious topics such as suicide. So I would say make sure that you're in a mental capacity to deal with it, and to be there for folks, because you will have people that will open up to you. Sometimes it can be a lot. And to be fair, I'm not a mental health professional, but I'm connected, and I'm so glad that people on the committee are, and I'm able to, if it's serious enough, being able to relay the message. But understand what we do, come to some of our events and get to know some of the people that you will be serving with or working with. All of that's important if you want to work with us and volunteer.
As a younger person on the committee, as well as a student at IUEs, how have you been able to open up to fellow students, or just some responses they've given you?
Yeah, so I also serve on our student government association. I'm actually the chair of community engagement and was appointed this year. And so one thing that I was intentional about doing is inviting some of the students to come participate and volunteer. And so because IUE sponsored and gave the cookies, I personally invited our committee members and the entire SGA to come and serve some cookies, talk to folks and learn some resources that are out in the community. And we had about six or seven people that showed up, and they were able to come and witness it, and they got to see a glimpse of what I do out in the community on the Reed side, which was always great, because so many people are like, I see you're very active, but then I have no idea what you do. So then they just for them to be able to see firsthand what I actually do and the type of stuff that we do deal with, was heartwarming for me.
Give us an example of when you arrive at a Out of Darkness walk, between the resource tables, the walk, the different things. So what can people expect?
Yeah, so I think first it's important for me to talk about what Out of the Darkness walk is. And so every year we host AFSP works all across the state, all across the country, to build these walks and to walk in solidarity with those who have been impacted by suicide, suffering, etc. East Central has one. We have it at the Wayne County Fairgrounds every year. And it's a way for people to understand what resources are out there. It's a way for us to walk in solidarity, build community, build connection, and interact with one another. And so when you first get there, you will sign in at the registration table. We have a bead table, and there's all these different color beads and to show your support for those through suicide. And so that, that's always heartwarming. There's a resource table, we have food trucks, we have stuff for kids, and then as well as we walk, I think it's like if you walk 5 laps, it's equates to a 5K. And so and then we have conversation. Usually people get to share stories, and it's just a way to build community and build connection for those who have been impacted. And if you have been impacted, to let you know that you're not alone in this journey, that you have a community.
This year there was something new, the Children's Pavilion.
Yeah. So we had, I believe, therapy dogs. I believe we had different prizes for kids to win. We want to make it family friendly for everyone.
They had some painting.
Yeah, painting.
Paint it down.
Yeah, I mean, you name it, we had it. And so it's just a way for us to make it as family friendly as possible. We really want everybody to feel, feel welcome in our space. We want people to feel appreciated. And to build that community and that connection. I keep talking about community and connection, but it's the theme and the core.
And then within the resource table, how many vendors? There were a lot of vendors.
Yeah, there was probably about 40 or 50 vendors that showed up. And again, they were cross sectors. Not everybody was there was represented by mental health. You had banks, you had, obviously hospitals, social services. IU East was in attendance, and so so many great vendors and partners were there to show support.
So then people walked away with a lot of swag too.
Yes, absolutely.
What's the most rewarding part of being a volunteer leader for AFSP?
Yeah, so the most rewarding to me is to be able to work with an amazing team of people who care so much about AFSP, who care about our community, and who care about our mission. And who care about advocacy. I'm an advocate, for many things, but for me, mental health and having those inspiring conversations and just being a light in a dark room sometimes is most rewarding to me, because sometimes I feel like I didn't have that. And so if I could be that person that I needed at, being younger, I'm always going to do that every time and show up to the table every time. But just working with amazing people and getting to know many different community members in counties that I necessarily may not work in, but just getting to know different people.
And with that, since you've looked at community and connection, what's some of the support groups that AFSP offers?
So AFSP does different programs. So for high school students, they do what's called More Than SAD. And it's taught over 1 million students and educators how to be smarter about mental health. We go over the language, because there are guidelines and there are different things that we should and should not be saying. And I'm happy to share that.
Could you share some of those things?
So when you're talking about suicide, you want to make sure that you have a safe place to talk about it. You want to define key message, and what that means is your story should not express pain, but it should be to educate and inspire hope. That's always important. Knowing your audience when talking about suicide. Be honest. And providing resources. That's for people who are talking about mental health. So just as myself, I should be following these guidelines and doing these different things. Another big conception is saying the word committed suicide. That is a huge stigma, and it's been ingrained in society, but I try to catch myself. It should be died by suicide, because they didn't commit to anything, but rather than died by suicide. And obviously avoiding discussions about suicide and the methods and all that, not being so gory about it.
So basically with the verbiage and the different ways, just to clarify.
Yeah.
Because some can be very cutting.
Yeah, it can. And so because I'm not a mental health professional, I don't know all the ins and outs. And so it's important for me to make sure that I maintain and stay by these guidelines, because I'm not a mental health professional, and what you don't want to do is say the wrong things.
Right.
It could cause more damage.
And how do they collaborate with healthcare providers?
Yeah, so
and other community organizations, similar to what I mentioned before, how it read, we have like a survey when you're seeing your physician.
Yeah, so one thing that we really focus on is outreach to our communities in which we serve. And so again, because so many people are on the committee that are working healthcare across sectors, we try to share a table. And what we might do is join on a Richmond farmers market. And all of us are there with our resources, they're representing AFSP, but we all do many different things. And so just being able to say, I work at Reed, but I'm also an AFSP volunteer. Here are some of the different things that Reed is doing, such as a survey, scan our QR code. You know, we have providers. Centerstone has providers, and you know, just being able to connect, just being a place of connection, because some people may not even know where to go.
And I know recently we were set up at the Richmond Farmers Market during the Harvest Fest. So there were reed tables, and then in the middle had a AFSP table.
Yeah.
And I think that made people more comfortable because it looked like they were just looking at the various tables. And then they were able to come up and say, what is this? And they start to share.
Yeah.
So that, once again, stigma.
Yeah. And so I kind of what to your point, I think that, you know, the more that we're able to talk about suicide, the more the way we're able to come and be authentic in the conversation, all that is helpful. And sometimes people might not want to go, you know, going to a hospital may be scary to people, or going to a mental health professional. But I think with an organization such as AFSP, where we're not trying to say, hey, you need to come do this, you need to come do that, but we simply want to give you a bracelet, and we simply want to give you a shirt. We simply want to give you a hug, and we simply want to tell you that you matter. You know, sometimes those simple but powerful messages, those symbols are absolutely important, and it can dictate somebody's day.
And what does AFSP do, like through advocacy, and how could someone participate in that advocacy?
Yeah, so one thing that we do for the advocacy is we hold different events. And so one event that's coming up November the 22nd is International Survivor for Suicide Loss Day, as well as the Out of the Darkness Walk, which is already passed. But just, again, community building. You know, one big advocacy piece that we do is we like to make sure that we are having educational spaces, you know, such as Reed being gracious enough to bring us on the show and to their network to be able to talk about this different thing. Those are advocacy pieces that we're doing. We're informing, we're educating folks, and, you know, we're energizing people to get serious about their mental health.
How can we encourage more open conversations about suicide among men, veterans, and first responders?
Yeah, so I think one thing that we could, you know, in my opinion, one thing that we could do is start hosting more opportunities for them to be vulnerable, you know, safe spaces, a place for them to build community connection. Because as a man, you know, sometimes we're taught, you know, not to cry, not to do this, not to do that, be tough, don't show emotion. But I think if you get people, good food is always a way to bring people together, gift card, you know, et cetera. And so just providing and creating a space for people to be vulnerable, you know, and a confidential space, because confidentiality is so important, but a safe, confidential space for people to be serious about it and to discuss and to community build, I think, are ways that we can break down some of those barriers.
We have, in our area, we're actually a rural health system, and we are a conglomerate of a lot of small towns. So how can a small town be involved with AFSP?
So AFSP already has different counties that we represent, but as far as towns, we have a committee. You could always go to afsp.org/Indiana or look up AFSP Indiana. You can always fill out a form. There's a volunteer form. And if your city is wanting to get involved, that form will then get sent to our committee. You know, to my knowledge, we've never told anybody no, and we want to loop you into those conversations because we're all here for each other.
Someone that was watching today, what would be a small step in healing or helping?
Yeah.
What would you suggest?
So somebody who's watching today that might need a message of hope, I would say to lean in on a community that has built you. You know, sometimes, and what I mean by that is sometimes those people in the life, you know, you're a person in my life who has helped me. You know, for one, leaning in on those people. Sometimes we forget that we have people there that truly do care. And sometimes that might be your third grade teacher. Sometimes it might be a mentor, you know, whatever it is, you know, outside of your family. You know, lean in on those people because there are people who care about you. And sometimes we can tend to overlook that. And sometimes we take it for granted. For me, a big thing on my heart after, going through a loss last week here on the IU East campus, one thing that sticks out to me is to remind people how much you love them. Tell them why they're here. Give them their flowers why they're here. Because a lot of times we don't, and then sometimes it's too late. And so that's what I would say to somebody who's looking for some hope, is to lean in, have conversation, be authentic, and show up.
Well, I want to thank you, Nathan, and being in all transparency. Nathan has been my intern for the last 4 years, almost my adopted child. So this is a proud parent moment for me. And we want to thank you for joining us today, and Nathan.
Thank you.
For Let's Talk Together. Thank you.
Let's shine by seeing the best in all of us and by treating you here, right in your hometown. Let's look out for each other. Let's stay healthy. Let's shine together.